Thank you, Mr. Speaker. Good evening, members of this Honorable House of Assembly. Good evening to those in the gallery. I'd like to say a special good evening to the Ministry of Health, my team, the A team that's in the gallery with us tonight, and good evening to those listening via radio or watching us stream live in HD this evening. Mr. Speaker, I am very, very proud of the members of this House of Assembly. I'm especially proud of my premier, our premier. I'm even proud of the leader of the opposition, as we all stand in solidarity with the people of the BVI. Mr. Speaker, I have friends and former colleagues who live in the BVI, and I empathize with them and all the people as they go through what will be a trying time. Mr. Speaker, recently we were in a similar position, so we know. So I have a few words for them from an African proverb, Mr. Speaker. It says, "Tough times make strong men. Strong men makes easy times. Easy times make weak men. And weak men make tough times. So raise warriors." So to the people of the BVI, those warriors amongst you, it's time to rise. So, Mr. Speaker, if you will, I would like for you to turn with me to Ecclesiastes chapter 9, verse 11. For those out there, it's Ecclesiastes chapter 9, verse 11. I'll give you a couple of seconds to, flip through either your Bible or your Bible app, okay? And it reads, "I returned and saw under the sun," kind of like my big yellow tie, "that the race is not to the swift, nor the battle to the strong, nor bread to the wise, nor riches to men of understanding, nor favor to men of skill, but time and chance happen to them all." Mr. Speaker, it is with mixed emotions that I deliver this year's budget speech under the House-specific theme, Delivering Health Services Beyond a Pandemic, which perfectly links to the overall budget theme, an economy that works for all, people, opportunity, and prosperity. Like never before, Mr. Speaker, we understand the link between the health of a nation and the overall economic well-being of a nation. COVID-19 has been the biggest crisis our islands have faced in generations, and arguably one of the greatest global challenges in a century. And Mr. Speaker, just to quickly clear up what the opposition-appointed member was saying, trying to discredit our vaunted Deputy Premier, who happened to be the Minister of Health when we took office. We were dealing with the second wave of COVID-19 in these islands. And the Cabinet, in its wisdom, which was continuing the vaccination program, ensured that all persons who needed work permits, PRCs, residency permits, et cetera, going forward, would be required to get their vaccine, which helped to increase and boost our overall vaccine numbers. That's number one. Number two, Mr. Speaker, our third wave, our very third wave, which was the Delta variant that we faced in late July going into August. Cabinet in its wisdom then required every visitor coming into this country to be vaccinated. And I remember clearly, the Chamber of Commerce wrote a big article on a big report, and they said we would lose upwards of $96 million in economic activity based on the wisdom of cabinet, making tough decisions in tough times. And guess what? Because of the stewardship of the Minister of Tourism, this has been the last budget year, the biggest and best ever in terms of arrivals to these Turks and Caicos Islands. So, Mr. Speaker, I will allow the Deputy Premier to clean up the rest tomorrow. Mr. Speaker, this pandemic has disrupted our lives to an extent few has predicted. Mr. Speaker, not even our retired scientists could have predicted this. I'm going again, unfortunately. Such is life. This pandemic separated friends and families, closed businesses, and damaged livelihoods. And most tragically of all, it has been associated with the deaths of 36 people in these Turks and Caicos Islands. Mr. Speaker, I would like us to take a moment of silence for those that has passed due to this pandemic. Thank you. Mr. Speaker, the rollout of the COVID-19 vaccination program in the TCI has been one of the most successful in the region, with 85% of the adult population being fully vaccinated. Through partnership, we have been able to reach this milestone, working with our stakeholders, including the FCDO, private health sector, TCI hospitals, and the multi-sectorial communications team. The rollout has included policy changes to affect the third dose and the rollout to 5 to 11-year-olds. More recently, the fourth dose has been approved and for the most vulnerable and has been rolled out to the general public. With this being said, there is much room for improvement as the current booster rate stands at 20%. Mr. Speaker, I will use this opportunity to encourage my fellow Turks and Caicos Islanders to take the booster, particularly those individuals with underlying medical conditions who are considered vulnerable or who may come into close contact with persons who may be vulnerable. I would also like to encourage parents to consider vaccinating their children to minimize disruptions of schools and to facilitate safe travel during the holidays and reduce risk to vulnerable people. Mr. Speaker, the oxygen generator project for the first time has allowed the TCI to make its own medical oxygen rather than rely on importation, thereby ensuring that the country is able to be self-reliant not only for this pandemic, but also beyond, and being able to manage its own resources. This is particularly important in the face of ongoing supply chain disruptions, which has come about due to COVID-19. This is a suitable investment in healthcare made by the Ministry of Health, which will benefit the TCI for years to come. Mr. Speaker, this is a great achievement we all should be proud of. This feat shows that positive lessons should be taken from our experience of the COVID-19 pandemic and support our ongoing efforts to ensure we are able to respond effectively and appropriately to this pandemic and any future health threats. Mr. Speaker, all of our lessons learned need to be incorporated into our future plans, thereby making the TCI's healthcare system more resilient through institutional strengthening and capacity building within the health sector, in my ministry and its related statutory bodies. We must also address the challenges affecting our health system. The pandemic has placed significant pressure on our health sector. However, I believe we will emerge from this stronger. We must organize a national health conference to properly document the lessons learned. Mr. Speaker, we must continue to support and pursue health system reform to create a new integrated system with emphasis placed on improving health outcomes for our people. This administration is confident that this can be achieved within our first term of office, Mr. Speaker. Our intention is to ensure that evidence and data guide decisions and future plans. In addition to increasing prevention and preparedness and response to pandemics, our plan is to develop a new strategy for health which is sustainable and meets the needs of our population through work which is well underway. As we inch closer to a post-pandemic world, greater emphasis will be placed on wellness and mental well-being. I pause to take note that this month is marked as Mental Health Awareness Month under the theme, Together for Mental Health. Mr. Speaker, mental health continues to be an area of focus, and my ministry will continue exploring opportunities to address this by supporting individuals, families, and communities. I stand here proud to announce that the TCI's first mental health facility will be opening this year and offering services to our residents. To this end, we will be hiring 8 additional staff members and adding over $500,000 to the Department of Mental Health and Substance Abuse budget. Mr. Speaker, if I do say so myself, and I do, this is what you call a good government putting its money where its priorities are. Mr. Speaker, policy without money is just a dream. And Mr. Speaker, in the words of the notorious B.I.G., who is late now, it was all a dream. I used to read Word Up magazine, Salt and Pepper and Heavy D in the limousine, hanging pictures on my wall. Every Saturday rap attack, Mr. Magic, Marley Marl. Mr. Speaker. Yes, I was entertained in my former life. But we got some dreamers in the house. So, Mr. Speaker, we are continuing to strengthen the primary health care department, which for the last 2 years has been on the front line of the TCI's pandemic response. I must pause again to congratulate the primary health care department, which has been spearheading the COVID-19 vaccine rollout, community testing, and contact tracing. This year, the department will be continuing its progress on implementing the primary health care renewal strategy. Your government, the people's good government, has approved capital funding for 2 new primary health care clinics for the islands of Providenciales, hopefully located in ED7, to be determined, and for Grand Turk. These projects will be undertaken in a phased approach. This will ensure that these islands have new state-of-the-art facilities which will provide a wide range of services to meet the needs of the general public and assist in our goal of improving health outcomes and healthier communities. With the pandemic receding, a greater focus will be again placed on primary health care. Mr. Speaker, the high prevalence of non-communicable diseases in our region, such as high blood pressure, diabetes, cancer, and other lifestyle disorders, has been further exacerbated by the impact of the COVID-19 pandemic, thus hindering our region's progress towards achieving the Sustainable Development Goals due to their multi-health, economic, and social consequences. Mr. Speaker, one of the people's good government's priorities is to develop a comprehensive approach to non-communicable diseases, with a focus on strengthening primary health care delivery and addressing risk factors such as an unhealthy diet, physical inactivity, and tobacco and alcohol abuse. We need to utilize all available resources to foster healthy lifestyles, strengthen primary health care, in community-based programs and promote food security, nutrition-sensitive social protection, including partnership with our local stakeholders across various sectors. Mr. Speaker, let me highlight and congratulate all those involved with the Let's Move TCI campaign, both Ministries of Health and Education, plus statutory bodies, the Sports Commission, and NHIB, along with all our private sector partners. Mr. Speaker, work is currently being undertaken on the non-communicable disease policy, which will guide all of these processes. Mr. Speaker, COVID-19 has shown us that single country solutions are not enough when it comes to the spread of communicable diseases in a hyper-connected, globalized world. Such crises can only be tackled effectively through collaborative actions at the national, regional, and international levels. There has been much dialogue about the 90-90-90 targets. These are global targets which have been established to help end the AIDS epidemic. I am pleased to say that this year, HIV and AIDS is again a high priority for the Ministry of Health and Human Services. We are also working on the elimination of mother-to-child transmission of HIV and congenital syphilis. Mr. Speaker, it is necessary to enhance the position of health policy and overall policy making by the government through the adoption of a health in all policies approach. This initiative demonstrates the provision of health extends beyond the boundaries of the Ministry of Health and Human Services, but needs a coordinated approach between multiple ministries and partners. If this pandemic has taught us anything, it's that health must be in all policies. Health in all policies is, oh, thank you. Health in all policies is one step to enable a collective, cohesive approach that is systematically done to encourage healthy living and improve the health status of all. Today's and future generations deserve to live in a clean environment where they have an opportunity to enjoy longer and healthier lives. Mr. Speaker, we are thankful to God Almighty that our beautiful islands have been spared during the 2021 Atlantic hurricane season. The Ministry of Health, through the Health Emergency Management Unit, continues to clearly focus on building pathways to resilience and disaster risk management, both as a part of the public and private sector, as well as within the wider TCI community. The unit will continue to focus on developing plans and conducting training to improve capacity to prepare for and respond to natural and man-made disasters. We stand ready to work hand in hand with our colleagues in the Ministry of Tourism and Environment as we all focus on combating the effects of climate change. Mr. Speaker, the people's good government will continue to invest in measures to reduce health threats, develop early warning systems, and strengthen surveillance and data collection while safeguarding individual privacy. This includes building on gains and lessons learned from this pandemic. Mr. Speaker, new dental equipment has been installed on the Family Islands. This year, approval has been given for the grant of 4 new posts in this department, 2 dental assistants and 2 dental surgeons. This will allow the department to offer secondary care services as well as improve outreach to the Family Islands and communities within the TCI. Mr. Speaker, prevention is always better than cure. Mr. Speaker, the nursing and midwifery unit continues to focus on a number of ongoing planned initiatives which are geared towards the strengthening of nursing and midwifery education and practice in the TCI in order to respond to the needs of the national health system following the COVID-19 pandemic. Mr. Speaker, some of these activities included joint discussions between the Ministry of Health, Ministry of Education, the Turks and Caicos Islands Community College, and the TCI hospitals, as well as regional and international stakeholders. Mr. Speaker, I'm proud to say again, as has been said earlier, just in case some people wasn't tuned in a little earlier, I'm proud to say that as a result of these talks, the third-year nursing students enrolled within the TCI Community College commenced their clinical practicum at the TCI hospitals on the 19th of April 2022. Mr. Speaker, this will represent our first cohort of locally trained registered nurses at the associate's degree level following completion of their overseas attachments. This is a significant achievement, and we are actively pursuing the future strengthening of the registered nursing programs on offer at the TCICC in order to attract more local persons to enter this field, thereby providing a more sustainable source of human resources for health in the TCI. Mr. Speaker, the National Emergency Medical Services human capacity will be further strengthened this year, or this financial year, with the approval for 9 additional staff members, including another supervisor of EMS, 7 EMTs, and a medical officer who will provide support to them. Again, Mr. Speaker, we are increasing their recurrent budget by $500,000. The additional staff will allow us to have a second ambulance base to be located in the Bight community, thus reducing response times on Providenciales. Mr. Speaker, all things considered, the long-awaited additional ambulances will be procured within this budget cycle. Be very close to finally having those 3 additional ambulances. And I know the Honorable Minister and member for ED4 will be thankful to get his ambulance back soon. Additionally, Mr. Speaker, a number of training opportunities for staff have been targeted both locally and in partnership with the UK as well as other stakeholders in order to build our human capacity. The department has also engaged with the fire department to foster closer working relationships, including training opportunities for more effective emergency response throughout the TCI. Mr. Speaker, strengthening our port services, our port health services through the development of a port health unit with 12 port health officers, 12 port health officers having been approved for this financial year. This will enhance the department's surveillance and investigative capacity to ensure greater compliance with environmental health regulations and the Ministry of Health's established policies as well as international requirements. Port health legislation is being pursued and has been placed on the Ministry of Health and Human Services legislative agenda. The department has been further supported with the establishment of a solid waste task force led by the Honorable Member from Wheeling. This will serve to steer solid waste management in the TCI. And Mr. Speaker, unlike the former holder of this post, who was rushy to find a particular solution rather than looking at the whole scope for the entire country rather than just one location, we are ensuring that we have a tailor-made system for all locations within the Turks and Caicos Islands as we grow our beautiful by nature Turks and Caicos Islands. The CDB solid waste project continues to progress, and a consultant will be selected to provide recommendations for a comprehensive solution in short order. The department will continue its obligations of protecting and promoting the health and well-being of visitors and residents through the implementation of quality public health services and programs. Mr. Speaker, the Special Needs Unit continues to be an area of focus in the Ministry of Health. I am pleased to say that the People's Good Government has doubled the allocation for treatment and care for this financial year from $233,121, the unaudited actuals, to $474,600. This demonstrates a clear commitment to improving access to services to the most vulnerable through programs and partnership with our partners, including the One World Foundation. Mr. Speaker, the reason partnerships and programs and commitment to improving access to services is important is regardless of a building. Once we ensure that the children and those who are in need get the services, we will all be better for it, Mr. Speaker. To assist our elderly clients, Mr. Speaker, the We Care program was launched by the Special Needs Unit in South Caicos, North and Middle Caicos, and Salt Key, which turned out to be a great success with a total of 52 persons benefiting from the program. Mr. Speaker, I had an opportunity to be a part of the We Care program when they were in South Caicos, along with the MP from South Caicos, to go and visit some of these homes and provide some very useful things, as well as do an assessment of those that need wheelchairs, walkers, etc., so we can ensure that we help our elderly. The unit also assisted with the distribution, again, of 36 pieces of adaptive equipment, inclusive of wheelchairs, walkers, and commodes throughout the Turks and Caicos Islands, with the assistance of the One World Foundation and Rotary Club of Watertown, which will make an impact on the quality of the recipients. Mr. Speaker, the unit is embarking on the reestablishment of the community-based rehabilitation program for persons with special needs in order to improve independence among persons with special needs by creating employment opportunities for persons with special needs, creating support groups, and creating independence through life skills programs. Mr. Speaker, the unit is continuing its efforts to build capacity and staff enhancement through an in-house and external training and recruitment of additional staff. I am delighted to announce that after 6 long years, an offer has been made and accepted for an in-country speech and language pathologist to join the team. It's a long time, long time. That Sri government's been trying to say. The department has also partnered with the Ministry of Education and the Mental Health and Substance Abuse Department to provide training for parents of children with special needs to empower them to apply the skills learned in their homes to support their families. And from side talks, I understand we might be also exploring the ability for us to have registered behavioral technicians from that group. So we're trying to uplift even those that participated already.
Honorable Minister, are you close to wrapping up?
I can be if I need to be.
Your time is about to expire.
Okay, I'll get straight to the closing, sir. I'm gonna skip a little bit in. Well, it's closing long, but I cut a couple of paragraphs. Okay, Mr. Speaker, COVID-19 has highlighted major challenges in our health services, and It has also highlighted our strengths, including the resilience, professionalism, courage, and innovative spirit of our healthcare workers. I would like to extend a heartfelt thank you, not only to my team, the A team within the Ministry of Health, but also to our local healthcare partners, including TCI hospitals, private sector healthcare providers, and the Cuban Medical Brigade. I'd also like to thank those that have recently left the A team, highlighting the former Chief Environmental Health Officer, Mr. Kenrick Neely, who served this country for over 25 years, but recently retired and moved on to a better opportunity, I believe. Also, I'd like to thank those that are about to leave the A team for a different opportunity. When you have the A team, you got to understand people can want to poach your best, so that happens. But I won't call their name because they might not want you in their business, though I appreciate them being in the house tonight. And those who are taking up new roles within the A team, including our very own local new CEO of the HRA, Mrs. Romaine Mizik-Smith. In addition to the nursing unit, is spearheading activities for Nursing Week, which is being celebrated from the 11th to 15th of May, which will include a conference under the theme of Voice to Lead, Invest in Nursing, and Respect the Rights to Secure Global Health. Couple more paragraphs, Mr. Speaker, on my last page. I ain't gonna read all of it. So, Mr. Speaker, the continuing investments in recent years, including 17% increase in staff hiring across the ministry. This budget has a 17% human resource increase in the ministry. That's putting your money where your mouth is. 17%, Mr. Speaker. So, Mr. Speaker, with the COVID-19 pandemic slowing down again, I reiterate my non-pandemic priorities. Solid waste management in the TCI and in Wheeling in particular. Progress is being made there, Mr. Speaker. Number two, improvements to the delivery of healthcare services. Mr. Speaker, progress is being made there in primary healthcare, which I explained in depth. It's also being made in secondary health care. Inter Health Canada, with the support of the ministry, is embarking on a project to get new, updated, and bigger MRI and CT scan machines, hopefully in very, very short order. The contract management team is also getting additional firepower, Mr. Speaker, because in the words of the former President George H.W. Bush, trust but verify. So we're giving them the additional support that they need in this calendar to ensure that they can verify all the activities so we can hold the healthcare providers in the secondary level to account. Mr. Speaker, for tertiary care, the NHIB, I must say, has very, very hard-working staff. Mr. Speaker, when we're ready, TCI people ain't easy, you know, and they have to interface with persons at their most vulnerable, keep cool, and deliver service to them. So for that, I thank you. But Mr. Speaker, we also know that we are going to be revamping this organization. We are hiring in this budget cycle 2 change managers, 1 operations, 1 finance, so we can make sure this institution that we hope to keep around a very long time, can function properly with those in it. So, Mr. Speaker, I end. Again, I need everybody to pull out their Bibles, turn to Ephesians 2, chapter 10, which states, Mr. Speaker, "For we are God's handiwork, created in Jesus Christ to do good works, which God prepared in advance for us to do. I'll say the last part again. Which God prepared in advance for us to do. Mr. Speaker, we are all here for this time, this period, to ensure our people get every opportunity to enjoy the prosperity of these Turks and Caicos Islands. People, opportunity, prosperity. May God continue to bless the people of these, our beautiful by nature, Turks and Caicos Islands. Thank you.